Welcome friends, welcome viewers, welcome on MuniMeterHealth, your source of learning cardiology and about human heart. Without any further ado, I'd like to say that this is purely an educational channel where we strive to achieve medical education and patient education in order to improve the health literacy and of course enhance thereby the clinical outcomes. So once again, welcome on MuniMeterHealth. Can the low LDL cause bleeding strokes? Now, we know that LDL, which is the bad cholesterol, it could be lowered enough to prevent ischemic strokes. Okay, so ischemia or the typical atherosclerotic strokes, which are like or the heart attacks, for instance, the MIs, they can all be prevented if the LDL, the bad, can be lowered. So if you lower the LDL, because we know that this is highly atherogenic, and the reason we call that atherogenic is because the low density particles, if I was to draw an artery here, for instance, and that showed the endothelial lining, for instance, here, and maybe perhaps here, one would see that the atherosclerotic plaque will start to develop somewhere here in this region in the endothelial wall. Now, the higher the LDL and the lower the HDL, which I always call it as the healthy particles of the cholesterol. If this is the combination, that's not good. Whereas the combination with low LDL and higher HDL is better. So the key is that we want to see that ratio not be disturbed and be in favor so that atherosclerosis does not occur. Now, atherosclerosis can occur in the coronaries, it can occur in the cerebral vessels, and it can occur in the renal vessels as well as in other splanchnic vessels as well. And of course, it can occur in the limbs, the arteries of the limbs. So these are the various arterial systems where atherosclerotic processes have been identified and can affect various diseases. Now, importantly, here I've shown the carotids. These are the carotid systems. If you look at the external carotid, of course, stays externally, does not go internally into the cranium, whereas the internal carotid, which is the ICA, this being the right and this being the left, they both go and subdivide into various arteries here. And of course, there's the vertebro-basilar artery here, which is present. And finally, all these arteries will anastomose and supply the entire right hemisphere and the left hemisphere, the right side of the brain and the left side of the brain internally. So these are the arteries. I've shown it schematically, obviously, here. So this way we can understand the process a little better. Now, the low LDL, which can be lowered up to, say, up to 100 milligrams per percent or per deciliter, that is sufficient enough to really prevent an ischemia or prevent an heart attack. But if LDL, which are lower than 70 milligrams in individuals, specifically whether on statins or not on statins, that becomes an extremely high risk for ischemia, for bleeding strokes rather. So for bleeding strokes, that's where the link has been established. So we need to know, and that was just recently published in the Annals of Internal Medicine. Annals of Internal Medicine, here I write it down, and of course in the Journal of Neurology, only in April of 2019. So just keep in mind that you want to lower the LDL, but lower is not always good. Low is not always good. So remember, lower LDL up to the 100 milligrams percent, I think you can prevent the ischemia because that's your major goal, ischemic strokes or ischemic heart attacks. But lower than 70, then you have an increased tendency for bleeding strokes. So therefore, you have to be very, very careful, and that's the cognizant. And again, the hypothesis, the theory here is this: the lower the LDL, especially in that range 50, 60, and 70, can actually lead to weaken these walls. So the weakening of the walls have been the reasons why such bleeding strokes have occurred. So weakening of the walls or the endothelium have been the result of and the bleeding strokes. Just remember that they are very, very deadly, and therefore they have a high mortality and more morbidity, whereas ischemic strokes, they still have a great chance to improve. But bleeding strokes, obviously, it's deadly because intracranially, if there is a bleed, that's an IC bleed, and that's considered as an emergency. And of course, the mortality and morbidity is very high. So just a quick note, low LDL can cause bleeding strokes, specifically so if it's less than 70. Okay, so meet you again on my next video. Looking forward to talk to you again, and keep watching MuniMeter Health. Thank you again. This was Dr. Jaitly. So long.